Sir Keir Starmer abandons plans to reform Britain's sick note culture. Sir Keir Starmer has decided to scrap the proposed reforms aimed at addressing Britain's sick note culture, according to revelations from The Telegraph. A key Conservative initiative, introduced last year, suggested that work specialists, rather than general practitioners, GPs, should determine whether employees are fit to work. The reforms sought to tackle the sharp rise in sick notes, now referred to as fit notes, which more than doubled from 5 million in 2015 to 11 million by 2022, exacerbating Britain's employment crisis. However, a Labour minister in the House of Lords confirmed this week that the plan has been abandoned in response to a parliamentary question. Baroness Sherlock stated, "The government has no current plans to reform the Fit Note, Statement of Fitness for Work, in terms of the content of the form or the healthcare professionals who are legally allowed to issue them." A spokesperson for the Department for Work and Pensions, DWP, confirmed that this is the first time the government has publicly acknowledged that the reforms are no longer moving forward. A Labour source indicated that the proposed reforms lacked sufficient detail. The number of individuals unable to work due to long-term illness reached a record high of 2.8 million in early 2024, compared to 2 million prior to the COVID-19 pandemic. This increase, partly driven by a rise in mental health-related conditions, has intensified pressure on the Treasury's finances. The cost to the taxpayer is expected to run into tens of billions of pounds to cover the UK's benefits expenditure, including support for those with long-term illnesses from now until the next general election, set for 2029. Critics of the current sick note system have raised concerns about whether GPs, who are compensated for appointments where sick notes are issued, have enough incentive to deny requests. Amid tight public finances and a focus on identifying potential budget savings, the Treasury, Number 10, and the Department for Work and Pensions share the goal of finding areas to cut welfare spending. Rishi Sunak's proposal sought to involve professionals with more work-related expertise, rather than solely relying on GPs to approve fit notes. Sunak stated last year, "We don't just need to change the sick note, we need to change the sick note culture, so the default becomes what work you can do, not what you can't." He further explained, "We're also going to test shifting the responsibility for assessment from GPs to specialist work and health professionals who have the dedicated time to provide an objective assessment of someone's ability to work and the tailored support they need to do so." A formal call for evidence was subsequently issued by the Conservative government, which highlighted concerns over insufficient work and health expertise within primary care to properly assess a patient's ability to perform work-related tasks.